So after completing the site determination and the anatomical position of this bone tibia, let us again see that this tibia is a long bone and it consists of the two ends, the expanded upper end, that is the condyle of the tibia, and then the lower end of the tibia, which shows the bony projection medially and downward, that is the medial malleolus. Okay, it is the medial malleolus. Now, as I said you that this is the left side tibia, because this is the medial malleolus. On this side is the lateral side where the fibula will come here. Sorry, the upper end has can be of the tibia can be divided into medial and lateral condyles. Okay, now this is the medial condyle of the tibia and this is the lateral condyle of the tibia. Okay, now this medial and lateral condyle of the tibia will show you a superior surface of the condyles are articular in nature of the medial and lateral condyles, and there is a presence of an intercondylar area between the medial and lateral condyle which is non-articular in nature. Okay, then there is a tibial tuberosity just below the medial condyle and lateral condyle. There is the presence of the bony projection and that is called as the tibial tuberosities. Thus the upper end we will study in three different headings, that is the medial and lateral condyles. This is the medial condyle. Okay, just see here, this is the medial condyle, this is the lateral condyle. Okay, and then this is the intercondylar area on superior surface, and on anterior aspect this is the tibial tuberosity. So we will learn the tibia in three different heads. Let us come first to the upper surface of the condyles. Okay, now the upper surface of the condyle consists of the medial articular surface or the medial surface of the medial upper surface of the medial condyle is articular in nature, and this is quite oval in shape. You see, just this is an oval in shape and quite large as compared to the articular surface or upper surface of the lateral condyle, which is small and circular in nature. See this is small and circular in nature. Let me show you with the help of a pen. So this is a almost circular and small as compared to the oval and large upper surface of the medial condyle. They are in living condition covered by the articular cartilage. Now in between these two medial and lateral condyle there is an intercondylar area. Okay, and this intercondylar area shows a bump or a bony projection here, that is called as intercondylar eminence. So this is the intercondylar eminence, and this intercondylar eminence presents the two tubercles, and this is the medial intercondylar tubercle. This is the medial intercondylar tubercle, and this is the lateral intercondylar tubercle. Okay, so this is the lateral intercondylar tubercle. Now if you go to the posterior surface of the medial condyle, see this is the medial condyle, and if we go to the posterior surface of this medial condyle, there is the presence of a deep groove. Okay, this is the deep groove present onto the posteromedial surface of the medial condyle. Okay, so this is the posteromedial surface of the medial condyle, which will show you a groove. Okay, now if you will see the posterolateral surface of the lateral condyle, this is the lateral condyle, and if you see the posterolateral surface of the posterior lateral condyle, then we will see a circular facet here. This is sorry, a circular articular facet is present, and this circular articular facet will articulate with the head of the fibula to form the superior tibiofibular joint. Okay, this is. Now if we turn to the condyle on the anterior aspect of the tibia condyle here, then both the medial and lateral condyle of the tibia, see this is the medial and this is the lateral condyle of the tibia, they fuse with each other and forms a triangular area. See, I will show you the triangular area. This is the triangle which is forming onto the anterior aspect of the upper end. Okay, so this is a triangular area is present onto the anterior surface of both the condyle. The apex of this triangular area presents this bony prominence called as the tibial tuberosity. So this is the tibial tuberosity and the triangular area is present here. This completes the description of the upper end. Now I will move to the description of the shaft. Okay, and if you will keep it in anatomical position, then there is a sharp anterior border with slightly convexity and upper end of which shows this tibial tuberosity. So this shaft shows the presence of the three borders and three surfaces. Okay, and three borders and three surfaces. Let us see the borders and surfaces of this. Now if you will see this, you will see that the borders are anterior. See, this is the medial plane or the medial side, and this is the lateral side, as this belongs to the left side of the tibia. If you will see this, this is the anterior border. Okay, and then there will be this border is called as the medial border, and then there is a third border also here, and this is called as the lateral or interosseous border. Thus there are three borders: anterior border, then the medial border, and then there is one border called as the lateral or interosseous border. Thus there will be three surfaces. Let us see the surfaces. Between the anterior sharp border and that of the medial border here, this surface which is smooth, okay, and this is called as the medial surface. It is subcutaneous, lies just beneath the skin, and you can feel the bone in your own leg throughout. Okay, now then there is a lateral surface, and lateral surface is between the anterior border and that of the interosseous border. Okay, or this posterior, say lateral border and that of the anterior border. The lateral border is also called as the interosseous border, and this surface here is called as the lateral surface. So this was the medial surface and this is the lateral surface. Okay, lateral surface. Now then between the medial border and that of the interosseous border, you can see, let me use the chalk. Okay, this is that interosseous border, okay, or the lateral border, and this is that medial border here. This surface here is called as the posterior surface. Okay, so now you understand the three borders and three surfaces of the tibia, right? So this is the tibia. Let us come to the individual borders. Okay, now I will trace the individual border. Again, coming back to the anatomical position, this is the tibial tuberosity, this is the anterior border is here, and if you just trace this anterior border, it extends from tibial tuberosity. See here, this is, and if you trace it downward, it goes here. So this is the anterior border, sharp border. This is going downward here, and this will go to the anterior margin of medial malleolus. This will go to the anterior margin of medial malleolus. Okay, sorry, not here. Anterior margin of the medial malleolus. If you keep on tracing this, okay, this will go to the anterior margin of the medial malleolus. See this? Anterior margin. This is the medial malleolus and it is its anterior margin, and this is going from here. See this? This is the anterior border. Okay. Now this anterior border you can feel just beneath the skin. That's why this border is subcutaneous, similar to that of the medial surface, which was subcutaneous. You can feel by the finger, pressing the finger throughout, okay, except in the lowermost part, okay, where it is forming anterior margin of the medial malleolus. Right, let us come to the medial border, okay, and this medial border starts from the medial malleolus. See this is the medial malleolus is here, posterior aspect, and then if you trace this border, that is the medial border from medial malleolus, this will be going downward and will form the posterior border of the medial malleolus. Okay, so anterior border was going to the it was going to that of the I mean to say the anterior border of the medial malleolus. This is going to the posterior border of the medial, because this is the medial malleolus. So anterior border, and this is the posterior border of the medial. So this is the border is called as the medial border. Okay, this is called as medial border. Now let us come to the lateral border or intraosseous border. See this sharp margin, this is the lateral border or intraosseous border. This begins just below that of the this facet for the fibula, okay, and then you can keep on tracing this border, okay, keep on tracing this border. This is the lateral border, and if you will see lower down, it is going towards the a notch at the lower end of the tibia, and this notch at this laterally facing notch on lateral side, and this is called as the fibular notch. So this will go to the upper end of the fibular notch. So this is which border? This is called as intraosseous or the lateral border. So we have traced all the three different borders. Let us come to the surfaces. If we come to the surface, that is, come first to the lateral surface, okay. So come first to the lateral surface, which lies between the anterior border and the lateral or intro. So this is the lateral surface, okay, this is the lateral surface is here. Now then come to the medial surface, and it is between anterior border, see this sharp anterior border, and this is the medial border, which is subcutaneous, okay, just lies beneath the skin, okay, which you can feel in your own leg. So this is the medial surface. Let us come to the posterior border, okay. We will have to turn the whole of the bone posterior aspect. You can see here on the posterior aspect, this is the posterior surface, okay, this is the posterior surface between the medial border and between the lateral border, okay, between the medial border and the lateral or intraosseous border, this is the posterior surface. Here you will see the presence of an oblique line, and this oblique line near the upper end is called as the soleal line, and I will draw the just from the fibular facet for the head of fibula. You can see this roughening, okay, this roughening is seen here. Let me show you in light. This roughening is there, and this roughening is going here, and this is an oblique soleal line, okay, this is oblique soleal line, and just above this oblique soleal line, this area which is present here, okay, this is a triangular area on the posterior aspect, okay. So this is the triangular area of the posterior aspect, okay, above the soleal line. And if you will see the area of the posterior surface below this soleal line, then if you can see, there is another elevated ridge which is going downward, not very clear in lower part, but this is the vertical line. This is the vertical line, and this vertical line will divide the posterior surface into two. One which is towards the medial malleolus is the medial part of the posterior surface, and then another is the lateral part or the lateral area and medial area. So by the vertical line, the posterior surface is divided into two areas, okay. Now after the shaft, let us come to the lower end. and this is the anterior aspect of the lower end. This is the medial surface of the lower end where the bony projection is going downwards, and this is the medial malleolus, and this is the posterior surface of the lower end, and this is the lateral where the fibular notch is present. Okay, lateral surface. So, and then there is one more surface here that is called as the inferior surface of the lower end, which is articular in nature. So the inferior surface of the tibia is articular, so the lateral surface of the medial malleolus is also articular, and this inferior surface, including both that of the tibia as well as of the medial malleolus, this will articulate with the radius. Okay, this no sorry I'm sorry this will articulate with the talus to form the ankle joint, so this is the inferior surface. Let us see the here the medial malleolus. Okay, if you will see the medial malleolus, it has a medial surface. Okay, and then you will see that there is onto this posterior aspect of this medial malleolus or to the inferior surface, there is a groove here. Okay, presents a groove here. This is on the posterior surface of malleolus. There is a groove is present here for the tendon, as we will learn in the next video. Right, so this is the posterior surface of the lower end of the which on the posterior surface of the medial malleolus shows the groove. Okay, now then what we have learned is that on the lateral surface there is a triangular area is here. See, on the lateral surface of lower end, and this is called as the fibular notch, which will form the joint with the fibula, that is the tibiofibular joint. It will form the tibiofibular joint. I hope you have understood the bony features of the upper end, of the shaft, and of that of the lower end. Thank you very much for watching this video.